Welcome to Business Authority Radio, bringing you insights from today's thought leaders, professionals, and influencers. With your hosts, Neil Howe and Craig Williams.
Hello and welcome to the show. This is your host, Neil Howe, and today my special guest is Dr. Norman Rowe. He's a board-certified plastic surgeon, and he helps men and women feel and look their best. He's board certified by the American Board of Plastic Surgery and is recognized both nationally and internationally as a leader and innovator in plastic and cosmetic surgery. Dr. Rowe specializes in breast procedures, rhinoplasty procedures, and revision procedures. His extensive experience can help patients who desire any type of face, breast, body, or skin treatments. Dr. Norman Rowe specializes in the latest and most innovative techniques to reduce scarring and trauma from surgery, and he is widely regarded for his short scar breast reductions. Dr. Rowe offers his patients the newest anti-aging treatments, including skin and body rejuvenation through both surgical and non-invasive methods. He continually researches new techniques and products to serve his patients' body and skincare needs. Dr. Norman Rowe trained as a plastic surgeon at New York University Medical Center and the Manhattan Eye, Ear, and Throat Institute. He also underwent an additional year studying microsurgery and breast reconstruction surgeries. He's been practicing in New York City for almost a decade. Welcome to the show, Dr. Rowe.
Thank you very much for having me, Neil. It's been a wonderful opportunity to speak with you and your listeners, and I'm very excited. And I hope to learn a little bit from you, and as far as questions, and also I hope to maybe give you and some of your listeners some information. So I'm very, very excited. Thank you for having me.
Well, in your bio there, I definitely gave a lot of education and the things that you've done. But tell me a little bit more about yourself and your business and, how you got started in plastic surgery.
Well, I started off in, like you said, I was trained in New York City at NYU, which is I call it the Mecca for plastic surgery. Not only New York, but NYU is very well regarded. And I just stayed here and in the New York area, and I've kind of gone out and branched out from the New York area. I've now gone from my initial office to, I think we're up to 5 offices now. We'll talk a little bit about that. And why plastic surgery? I always wanted to be a plastic surgeon. I always wanted to, be. I like the ability to create. I always want to be a doctor, and I always like that ability to, and obviously it's kind of cliche to help, but I like the ability to kind of create. I like the artistic aspect of plastic surgery. I find that a lot of other areas of medicine, from my experience, it's kind of algorithmic. Someone comes in with this, you do this. Someone comes in with A, you do B. You ask 2 plastic surgeons how they would solve a problem, they'll come up with 6 different answers. And that's, because there's no real one right answer. There's multiple answers, and it's all kind of the way you want to take things or how you look at a problem. And that's kind of what, really appealed to me. I always wanted to do this. I mean, somewhere in my family's home back in Louisville, Kentucky, there's a picture of me in first grade, where you dress up in career day. And somewhere in there's a picture of me dressed up in a pair of scrubs, because I not only wanted to be a doctor, I not only wanted to be a surgeon, but a plastic surgeon. So I think there's somebody said for following your dreams, which, I certainly did. And I came up to New York and I kind of stayed here. I found an interest in breast. I mean, like you said, I studied breast and breast reconstruction. And I think that if you can make someone a breast from scratch, which is a lot of times the cases that we do when, the cases, when we have like a breast reconstruction after cancer, you can certainly improve on somebody's breast when they say, I have a cosmetic issue. And so I think having the background of reconstruction, where you start literally from scratch, from nothing, and you can make a really aesthetically pleasing breast, I think it gives you a heads up on, or a leg up, I should say, on making someone a better looking breast. And I think that carries through not only with breast, but the reconstructive aspect when we were doing reconstruction, we not only did reconstruction of breasts, but we did reconstruction of faces after trauma, after cancers. And if you can make someone a nose after their nose has been literally removed or very badly injured, you can certainly, and you can start from scratch, you can certainly take someone and make their nose, which they have, which they might think is horrible, but you can take their nose and make it better and certainly improve on it. So I find that the reconstructive background kind of, not just kind of, but it does definitely give you a very big leg up on helping patients, and I just enjoy what I do. And I always tell my kids, you have to, and I'm sure you know this as well as I do, you have to enjoy what you do. If you don't enjoy what you do, even if you get paid well to do it, it's just a torture getting up in the morning. You have to jump out of bed and just can't wait to get to work and just love what you do, regardless of whether you get paid well or not, and if you happen to get paid well, great. If you don't, then at least you're enjoying yourself along the way. And that's kind of the way I feel. And I opened up shop here in New York, and we went from one office to, I guess now, 3 offices and 2 spas. So it's been a very, I shouldn't say wildly successful, but I guess we're doing something right. Our patients are happy. We're now, 2 states and continuing to grow. There's, patients like our techniques and like our results.
Yeah, well, congratulations on that. It's great to see small business get growth like that. Obviously, you're doing something right if you continue to grow like that. Now, tell me a little bit about the history of plastic surgery, because what you mentioned there with the reconstruction, there's definitely a functional purpose there, and then you've got the cosmetic surgery side as well, which has maybe a different role.
That's actually that's a great question. I love the history of medicine. I love the history of plastic surgery. I think you have to, regardless, they say this, you have to know your history, otherwise you're kind of doomed to repeat it. And the history of plastic surgery is very full and very colorful, with quite a few colorful characters. And I shouldn't say doomed to repeat it, but it's actually a very interesting history that I think any plastic surgeon and patient would be interested in knowing. The word plastic comes from the Greek plastikos, which means to mold and to form, to bend. And that's kind of what plastic surgeons do. They mold, they form, they make. And that's kind of where plastic comes from. I mean, if you think about what plastic is now, like a plastic container, when you heat it up is liquid, and you can pour it into a mold and make it into pretty much anything you want. You can make it into a cup, a dish, a bowl, or a blinker on your car. So that's kind of where the word plastics comes from. Plastic surgery prior to World War I just didn't exist. Plastic surgery prior to World War I and during World War I, a lot of I guess it's more of World War I. World War I, if you remember from your history class, was trench warfare. So there were a lot of soldiers who would kind of stick their head up out of the trenches and kind of look up to see if they were going to advance 100 yards or so. And sometimes they would get a bullet in either between the eyes or in their jaw. Obviously, when it goes between the eyes, they were instantly dead. But what trench warfare did, it produced quite a few of what I'll call the walking wounded. Soldiers who weren't killed but were severely injured and maimed because they took bullets in the face or in the jaw that didn't kill them but broke a lot of bones, and they needed reconstruction. Most of that reconstruction of the jaw, of the nose, of the cheekbones, there was no real surgeon or no real doctor to kind of take care of that. So, and they said, well, who better to take care of the injuries to the face than someone who deals with the face? A dentist. So a lot of the early reconstructive plastics who dealt with a lot of the injuries in and about the face, which is kind of where plastic surgery started from, were actually dentists. And they kind of, and they in World War II. Well, after World War II kind of came to an end, the dentists who did develop a lot of skill in treating injuries in and about the face kind of went about their private practice, and then things kind of went back to normal. Then rolls around World War II. And World War II brought about a lot of injuries that were, again, kind of unique. They were injuries, if you remember Royal Air Force, the British were defending themselves against the German onslaught, and the Royal Air Force were seen as the last-ditch effort, the heroes to all of Great Britain. And they were told at all expense, bring your planes back, because sometimes actually right before the America got into the war, the planes that the British were flying, the pilots were flying, were actually worth more than their lives, because there was blockades and they just couldn't get parts in. They were told at all costs to bring their planes back to the ground, even though they got shot up. So when they got shot up and the cockpits were burning, they would take their gloves off so they would feel the instruments. They would take their goggles off so they could see, because it was all cockpits were all smoky, and then land the planes, and they would land the pilots with severe burns to their hands and in and about their eyes and face. So they said, we need someone to take care of these injuries. And there were quite a few dentists, so they said, let's get some of the dentists for World War I. Well, they were already kind of long gone, and so the whole new era of dentists kind of came in and about to kind of take care of these burn patients, and quite a few famous hospitals in Great Britain and in London came about. Great Ormsby Hospital on Great Ormsby Street came about in that time to kind of treat the heroes of World War II, which were really the pilots of Great Britain, of the Royal Air Force. And a lot of the techniques and the surgeons, McIndoe and what have you, they came about from that era, were the first real plastic surgeons. The good thing about it is that the skills and the techniques they developed in reconstructing the face, those guys, instead of going back to their job and kind of disappearing into the woodwork, they kept their skills alive and started the group, kind of what we know now as plastic surgeons. They started the specialty, I should say, of plastic surgery. So plastic surgery, even though it's been around, since World War II, it really kind of stuck hold in the late 40s, 50s, in the American Societies of Plastic Surgeon, American Society, not American Society of Plastic Surgery, but kind of plastic surgery as a whole really took hold in the late 40s, early 50s. And then in the 70s, and it was really reconstruction that they did. And then in the 70s, it kind of delved into, well, if we can make someone's face look better after a burn and do reconstruction, we can take someone who is pretty bad and make them good, then we should be able to take someone who is pretty good, meaning they're not injured, and make them better. And that's kind of where plastic surgery, cosmetic surgery came in, which really kind of took off in the 60s. I'm sorry, in the late 60s, early 70s. And that's kind of a plastic surgery in a nutshell.
Well, that's a story that I've definitely never heard before. Mm-hmm. And going from the need in the war to now the cosmetics, and let's talk about the education here a little bit, because it's kind of come full circle to where it started with the dentists, but now there's a whole industry about plastic surgeon. I mentioned that you were board certified,
right? And
there's a lot of education going in there. But there's also another kind of arm or part of cosmetic surgery, maybe, that is still done by dentists or people that aren't necessarily as qualified as you. Talk to me about what's happening there.
That's actually a very, very good point, Neil. And I think a lot of your listeners should, obviously, if they're thinking about plastic surgery, know what you're getting. I kind of joke with some of the staff in the office is that some of our patients spend more time looking at which car to buy or which bag or something or purse to buy, as opposed to who's going to operate on their body or their face. For me, I've trained I've trained in general surgery, plastic surgery, microsurgery, hand surgery, and that is what a plastic surgeon is. Unfortunately, at least in New York, anybody can call themselves a plastic surgeon. Anyone can, in your office, you can pretty much do whatever you want in New York State. If I wanted to do brain surgery in my office, obviously I wouldn't. But if I wanted to, legally in New York, you can. You can pretty much do whatever you want in your office as long as you have a medical degree. Now, obviously, I'm not qualified to do brain surgery, nor would I, but someone who is, say, a obstetrician, a gynecologist, a dermatologist, a dentist, or what have you. They can pretty much do whatever they want in their office legally. So some people, I'm not saying all, but some people go down to Miami or Atlanta, take a weekender course in Botox, and now they can come back and you can call yourself whatever you want legally. So you can call yourself a plastic surgeon and say, hey, I'm a plastic surgeon, and when they've taken a weekender course. Meanwhile, I've trained for 10 years before I even touched a patient, I had training of 10 years. So, and what they're doing, that's legal in New York State. As long as you have a medical degree, you can practice whatever you want in your office. Now, I tell my patients, they come in and say, oh, I saw so-and-so, and that person is a plastic surgeon, and I know who they're talking about if I do. And I'm thinking, well, no, that person is actually a pediatrician. No, that person's actually a gynecologist. No, that person's actually a pediatrician. Anyone can do anything they want in their office. I'm not saying it's the smartest thing in the world to do, but anyone that can, and they can call themselves anything they want. So what I always tell my patients, and I hope your listeners, if they take one thing away from all this conversation that we're having, is ask your doctor who you're contemplating. If you're contemplating doing any type of plastic surgery, whether it's a surgery or whether it's an injection or a laser, what are you trained in, or what are you board certified in? I'm board certified in plastic surgery. A pediatrician who goes down to Miami and takes a weekender course in plastic surgery, he or she can call themselves a plastic surgeon. But you ask, what are you board certified in? They're board certified in pediatrics. And then if that's the case, I'm not sure I would proceed. And that is if they are board certified in anything. Again, in New York State, as long as you have your medical degree, you can really practice. So there are some people who finished med school, did 1 year of training, and they can get their degree. They have their degree, and they're not board certified in anything. So I guess what I'm telling your listeners is, if the answer that you get when you ask the doctor, what are you board certified in? If it's anything other than plastic surgery, I'd walk away. If it's anything, if it's pediatric, if it's OB, or if it's nothing, obviously you walk away.
Mm. Well, that's a definite warning. There's all types of people that pretend to be a plastic surgeon, but being a board certified plastic surgeon is what you need to look for, because ultimately you are the specialist in doing what they are exactly looking for. So let's talk about the specialist part of it. What in your office would you say that you are a specialist at?
Well, kind of broadly, and this is kind of an interesting thing to say as a surgeon, with the word surgery in my title of what I do. I'm trained in surgery. I heal people. I treat people with a scalpel, and that's kind of one hat that I wear. A few years into my practice, I kind of discovered and started working on ways to treat people without a scalpel, without cutting them, without putting them under anesthesia. And I think the trend in plastic surgery kind of followed, and the trend is less and less scalpel, more and more non-invasive. I'll call it non-surgical treatments, because some of the non-surgical can be a little bit invasive, but it's still not using a scalpel. So what do I specialize in? I think as a plastic surgeon who is trained in cutting people or operating on people to make them better, and also because I'm also trained in and well versed in non-surgical options, the lasers, the Botox, the fillers, the non-surgical options for anti-aging. Because I'm trained in both of those, I think it gives me a good opportunity to talk to my patients about which option is best for them. Not every patient needs surgery, and honestly, not every patient is a good candidate for non-surgical options. They need surgery. If someone is only trained in one and can only only has one hammer, then everyone is the same nail. If I have two different options that I can offer someone, And because I am trained in both, I have no vested interest in surgery or non-surgery. I can offer patients both. If I was someone who was not trained in surgery and can only offer someone needles, injections, and lasers, I'm going to tell them they're going to get the same result that a plastic surgeon could get with surgery. I can get you with non-surgery. Or if I was just trained in surgery and I say, and I don't do lasers and Botox, I say your best result is going to be with surgery. But I am trained in both, and I can give a patient my honest opinion as far as what is going to be best for them in relationship to how much time they want to put into it, how quick of a result they want. And I guess another caveat is how much they want to spend, or how much money and time. So I think, what do I do best? I give my patients an option, whether it be surgery or non-surgery. A lot of plastic surgeons don't do non-surgical options. Surgery is in our name. We operate for a living. But I not only operate for a living, but I offer my patients the latest techniques in non-surgical options. And so patients come to me, they know that they get what's best for them, not just what I can offer them. So what do I offer them? Whether if I see a patient, I say, you could have lasers and Botox all you want, but your best option is surgery, I'm giving my honest opinion. If I see someone who's saying, well, I'm not sure I want to do surgery, I'll tell them, I agree with you. I think with using a laser here, or a Botox here, or a minimally invasive technique there, I'll get you the result that I could, normally get with surgery. So I think what I do the best is give patients options.
Okay. So what would you say you deal the most with? Is it mostly the non-surgical? I imagine that would be, around the face and maybe some anti-aging stuff. Or would it be more the breast augmentation or body contouring?
The national. Before I answer your direct question, I'm going to be a little like a politician and answer it the indirect method. The national trend in plastic surgery over the last 15, 20 years, without a doubt, has been non-surgical. 75 to 80% of what plastic surgeons do today is non-surgical. 75 to, that's huge. 80% of what we do is injections, lasers, acid peels, and things like that. And that's kind of the national average in the United States. In my practice, I'm probably closer to 50-50, and that's because I operate quite a bit, but I still offer my patient, and that's because I have a large surgical practice. And in those patients, does that mean he's operating on patients that he otherwise should be doing non-surgical on? No, I get patients who they're really kind of I'm kind of almost like a tertiary referral center. I get patients where other people have tried non-surgical options and it just doesn't work. So I get a kind of a self-selecting patient where surgery is their last ditch effort or their only option. So that's why my numbers are 50-50 as opposed to 80-20. So about 50% of my patients I operate on, 50% I do non-surgical, whether that be lasers, Botox fillers, the latest in fillers, string lifts. I like that. It's a non-surgical technique or a minimally invasive technique where we kind of lift up the skin as opposed to cutting it. The latest in non-surgical fat reduction. So in my practice, it's about 50-50. And that's just because I get patients who referred to me who have already tried the non-surgical options and they just have failed.
Well, an add-on question to that is, what percentage of your business would you say is strictly cosmetic, and what percentage would you say is the conventional reconstruction for like a mastectomy, like you were talking about at the beginning?
15 years ago, when I first started out, a large portion of my practice was reconstruction. Probably 60% was reconstruction, 40% was cosmetic. Over the course of the years, I should say, you sort of get pigeonholed. And now I'd probably say at least 90% of my practice is cosmetic. I enjoy the reconstruction, and I really do, to the point where the 10% that's still reconstruction is still not enough for me, and I still go and I volunteer at the local hospital to kind of cover some of the reconstructive cases because that's what I'm trained in, and that's what I enjoy everything I do, but I miss it. And when it started slowing when I started getting busier with cosmetic, and I just didn't have reconstruction. It takes quite a bit of time. It takes much more time than, say, cosmetic, in most cases, than cosmetic surgery does. And there's just wasn't a lot of, as time got short from, time in the weeks, not enough hours in a day to do what I'm called upon to do. For me, I just shortened up my reconstructive side of my practice, and I miss that. So I do volunteer locally, but at this point in my career, I'm probably at least about 90% cosmetic.
And that seems to be the trend, all over the country as well, as the cosmetic procedures are really taking off, and, well-qualified doctors like yourself are in need for all these cosmetic procedures. So it tends to dominate the practice. So tell me, what is new in cosmetic surgery? What in the last year or two has come out to make things a little bit different than they were before, and what do patients need to know that's available for them?
I think globally, the latest and greatest thing in plastic surgery is the minimally or non-invasive methods for anti-aging. And you say, well, if you kind of think, we say, well, anti-aging methods, minimally invasive, have been around for 20, 30, 40 years, but what has changed in the last 10 years versus what was available 20, 30 years ago is the actual non-invasive methods now work. Even as recent as when I started, I guess 14, 15 years ago, there were methods out there where fat reduction, cellulite reduction, this, that, and the other thing that were out there that, looking back, was quackery, for lack of a better term. I mean, things that just didn't work. The reason the non-invasive plastic surgery in the last 7-8 years has taken off is for one simple reason, and that is non-invasive plastic surgery methods actually work now, whereas before they didn't. If you have, 7 different answers or 7 different solutions to one problem, that means basically there is no good answer. But in the last 7 to 10 years, the reason it's taken off is because the results are there. Without a doubt, the non-invasive methods they work. They give us a better looking result. They give us a more, help with the anti-aging. And I think that is the kind of thing that has happened, or the event, the impetus, the event that has happened in plastic surgery in the last 10 years. And that's new. Now, what do we do with all this knowledge? Or what do we do with what's new out there? Well, I think what the main thing that people, again, have to take home with all these non-surgical methods versus, and I always tell my patients, is non-surgical versus surgery. And again, I think I'm uniquely qualified, as well as any other plastic surgeon, to say this, because we do both, or we can do both. I do both. I do non-surgery and surgery. I tell my patients, surgery will never, ever be replaced. So if you go to a doctor who says, you'll never need surgery, that's someone who doesn't offer surgery. But because I do offer surgery and offer non-surgery, I can say surgery will never be replaced. In a certain patient, you could do all the Botox or all the lasers in the world, and you're not going to get the result of, say, a surgical facelift. So surgery will never be replaced. But the main difference, I tell my patients, and the main thing that has happened, I think, in the last 5 to 10 years is, I'll tell them, I can get you the result of a facelift, but a good facelift will last you 7 to 10 years, if not more. Lasers and Botox, if it lasts 2 years, I'm happy. So the difference between non-surgery and surgery is generally surgical results will last you longer. So if you're okay with coming in every 2 years, whereas a facelift will last you, say, 10 years, but and whereas Botox and lasers every 2 years, you're okay with that, then you go ahead with the lasers and Botox and non-surgical methods, as opposed to the facelift. Now, obviously, if you come in every 2 years and you have to come in for 5 years to get the result of, say, 5 times to get the result of, say, a facelift, which lasts 10 years, there's a cost factor there where almost the non-surgical methods start becoming equivalent to surgical methods. And the thing that I've noticed a change in the last 10, 14 years is people say, I'm okay with that. I'd rather come into you every 2 years, every 9 months, every 2 years, whatever, to look good rather than undergo surgery. And that's, even though I tell some patients, you're better off with surgery. And I think that's a big change in patients. Patients just don't want surgery. They want anything where they can get the result. And even if it is a shorter lived result, they're okay with that. Now, what's new in plastic surgery, kind of go back, really to nail down your question. I think what's holding promise is some of the new laser techniques. Some of the new lasers are becoming, I think, in the last 2 years, 3 years, and I think it's going to continue for the next 5 years. We're getting some of the results that we used to get with some of the more aggressive lasers, say the CO2 lasers. We're getting those results now with less aggressive lasers. So I think we're getting there's less aggressive, meaning less downtime, I should say. It used to be 15, 20 years ago, if you lasered someone with a CO2, they were lobster red for 2 months. Now we're getting the results of, say, a CO2 laser with erbium or fractionated lasers, and we're getting those results, but they're red for a week. So I think the techniques are improving, the downtime is decreasing, and I think that patients see that and they just say, I really don't want surgery. So I think less and less invasive, and better techniques, better machinery, better technology is helping. I think something that's going to be very promising in plastic surgery, and I've already got, seeing some results with it, is stem cell therapy. If you think about, well, what is stem cells? Stem cells are putty. Stem cells can become anything in which you put them. They are the box, as they say, the box determines the contents. If I take a stem cell and put it in someone's joint, it becomes cartilage. If I take a stem cell and put it in someone's heart, it becomes a heart cell. If you take a stem cell and put it in someone's skin, it becomes new skin cells. So now you not only have a way of rejuvenating someone's old skin cells, now you have a method of making a brand new one. So what's better, fixing up your old beater car or buying a brand new car? Buying a brand new car is better. So I think that is tremendous potential, at least in plastic surgery. We have not even begun to tap the potential of stem cells. I've been using it in my office. I'm very pleased with the results, from everything to wound healing, helping scars look better, to hair growth, to making your skin look better and tighter. I mean, what's better than, like I said, what is better than rejuvenating your old skin, making brand new skin? I think that's where stem cell therapy is coming in, and I think that has phenomenal potential in the next 5 years.
Yeah, exciting times ahead, definitely, in plastic surgery. But, you plastic surgeons do a great job of making people look great and rejuvenating them. But answer me this underlying question. I'm sure it's a very in-depth answer, is why? Why are people going to all this effort to either go under surgery and get cut, or maybe less so nowadays with the non-surgical methods? But why are they doing this? Tell me the mental side. One of my favorite books is Psycho-Cybernetics by Maxwell Maltz. Are you familiar with that one?
I've heard of it. I've never sat down and read the book, but not meaning to interrupt, but back to your question, the answer to that, Neil, is very simple. I always tell, students that I work with that, that come in and rotate in the office and, to learn, that we as plastic surgeons deal with a very unique patient population. A lot of people, if you look at it very superficial, a lot of people, when you're ill, when I'm sick and I have a cold or something, or I have drop a weight or something on my toe, I go to the doctor. So you go to the doctor when you're ill, so the doctor makes you better. That's kind of in the perfect world. Where plastic surgeons, you kind of look at it superficially. You say, well, your patients are well, so they come to you when they're well and they want to be made even more well or even better than they were before. So what do you call that? When someone has appendicitis and the general surgeon takes out their appendix, they go to the doctor and they're sick and they're made better. So they're operating on the physical. I, as a plastic surgeon, why? Very simple. I'm operating on their soul. I'm the surgeon of the soul. That's what plastic surgeons do. We make their soul better. If that's, and I know it sounds cliche, and you go, well, that sounds kind of strange. And what do you mean by their soul? If something bothers someone, if this little bump on my nose bothers someone, if this asymmetry in my breast bothers me, if the fact that my breasts are small bothers me, And that problem can be fixed, and it can be fixed relatively, two requirements, relatively easily and safely. Then I guess the patient's question is, well, why shouldn't I do it? So as a plastic surgeon, especially a cosmetic surgeon, not a reconstructive surgeon, because a reconstructive surgeon, we are operating on patients who are not physically whole. But as a cosmetic surgeon, we are operating on patients who are physically whole, but we're operating on patients who are not, their soul is not whole, their psyche is not whole. So as a cosmetic plastic surgeon, just as if they had appendicitis, there's something wrong with the soul, and I am operating on their soul. That's what a plastic surgeon does. That's what plastic surgery is. It is surgery of the soul. Just as much as a general surgeon taking out a ruptured or inflamed appendix is surgical on the physical, a plastic surgeon operates on surgery of the soul. And that's a very simple kind of a way to look at that, but that's the way I choose to look at it. And I think a lot of patients
I really like that analogy, actually. I like to think of it also like the iceberg. The tip of the iceberg might be the improvements that you make on the body, but ultimately what you cannot see is what is underneath or what's inside, and the difference that you make to somebody's life. So, Dr. Rowe, we're almost out of time here. So give me an example of somebody that has come into you that had some problems, maybe a confidence problem. They came to you, they got some work done. What was the outcome for them? How did it change their life?
Let me tell you what I like to think I have a lot of examples of that, and I think I do, but one that comes to mind now that you mention it, I had this young girl come in. She must have been 15, 16 years old. It was July. It was a hot summer day here in New York. And she comes in with her mother wearing a sweatshirt, a heavy sweatshirt, and it was just blatantly out of place because it was hot here. It was middle of July. She comes to me because her breasts were very, very large. And also her nose, I think, her nose bothered her. She said, my nose is a little bit too big, what have you. Pretty girl, beautiful eyes. And I did a breast reduction on her, and I did a rhinoplasty. Everything went well. And I happened to run into her about a year and a half later on the boardwalk at one of the local beaches. I saw her and I recognized her, and I didn't say anything. And she recognized me. And it was almost 2 years later to the day, because I remember it being July, it was hot. And she was sitting on the boardwalk with like a tank top, a little white beater shirt, with two of her girlfriends and a couple other guys kind of sitting on the beach eating ice cream. And she was now wearing a white beater t-shirt or swim top, something more appropriate, hanging out with her friends. So she was probably at this point 17, 18 years old. And that was probably one of the more gratifying moments, from surgery. That is something that you operated on. I operated on that girl's soul. I made her, came out of her shell. She was a beautiful girl to begin with, but now she saw her beauty. She thought felt her breasts were a little bit too large. Her nose was a little too large. And that is what we as surgeons of the soul want to do. We want to take someone and help them not only see their potential. And that's what I did with this particular case. And that is what we as plastic surgeons want.
Just giving them confidence, and confidence
Correct.
is so important to,
Yes.
in every aspect of life, going forth and, just getting things done, having that confidence to be able to go out and do it is extremely important. Well, Dr. Rowe, it's been a pleasure talking to you today. We've covered a lot of different aspects. If there's one thing that you would like to leave our audience with that we might not have addressed yet, what do you think that would be?
Well, I know we addressed it, but it's so, so very, very important. And I think we said it right at the beginning of your show. Know your surgeon, if they are indeed a surgeon. The key question to all your listeners, if you're contemplating any type of plastic surgery procedure, the one question that you're going to ask that person is, what are you board? What are you certified in? What are you trained in? And like I said, if the answer is anything but plastic surgery, think long and hard. If not, think long and hard at the very least, I would probably get up and walk away. So that's probably my takeaway message I would leave your listeners. And obviously, if they have any questions or any questions about the procedure or anything, please give my office a call. You can go to my website, normanrowemd.com, and I have 20 staff, and I personally answer all, if not all, most of the questions we get online.
Excellent. Well, I really appreciate you taking time out today to talk to me and our audience. And is there a phone number that they can call as well?
Absolutely. We have offices in Long Island, New York City, New Jersey. We can give you a central number to call, and that number is area code 212-628-7300. It's 212-628-7300. We have 3 offices in and around New York, New Jersey area. 1 in New York, 2 in New Jersey, 1 in North New Jersey, 1 in South New Jersey. We have a spa out in Long Island, out in the Hamptons, in Watermill, called Type Med Spa. And we also have and we're very, very excited about this, a men's-only center for rejuvenation, where men can go and not feel uncomfortable about sitting next to a woman who's had her breast augmentation or a facelift, or there for their lips. It's a male-only facility, and we call it the Clubhouse. If you want to learn about that, you can go to theclubhouse.nyc and schedule an appointment. And obviously, everything's in confidence. And we're very excited. We had a lot of success with that. There's just a whole arena out there of men. Again, 20% of our practice is men who just want procedures done in a little bit more of a masculine kind of a clubhouse feel. And that's what we've created. And we're very excited. And it's been very, very gratifying to see men kind of come out of the shell, because they're the forgotten people and forgotten recipients of plastic surgery. Half the world's population are men. And a lot of them are coming out and say, you know what? I want plastic surgery too. Well,
that's certainly good to hear. And Dr. Norman Rowe, it's been a pleasure talking to you. I know a lot of people will travel to get their plastic or cosmetic surgery done. So even for the people outside the New York area, make sure you go to his website, normanrowemd.com, and check out everything that he has going. So thank you very much, Dr. Norman Rowe, for being my guest on Business Authority Radio today.
Neil, thank you very much for having me, and it's been a pleasure.
And to our listening audience, if you like what you hear, hit that like button and share, and we'll see you next time on the show.
You've been listening to Business Authority Radio with Neil Howe and Greg Williams. To learn more about the resources mentioned in today's show, or to listen to past episodes, visit businessauthorityradio.com.